Good morning, guys. I am Catherine Janel Teves, and I will be discussing the 2019 public health issues, which is the major issue is the Ebola virus. 2014 Ebola epidemic dominated in international headlines. The response to this crisis was only one mission the CDC undertook during the past years. Also, in response to the ongoing Ebola pandemic or Ebola outbreak, in West Africa, the CDC has deployed 170 staff in the field and has more than 700 people serving in the other capacities at the given any time. It is also stated that Frieden said that it is crucial to address the issue in West Africa to ensure global safety. The 2014 to 2016 outbreak in West Africa was the largest Ebola outbreak since the virus was first discovered in 1976. It also was the seventh outbreak of Ebola virus disease since it was discovered. Also, it has more cases and deaths in outbreaks than all over when you combine it. It also started on Guinea, then quickly spread to the neighboring countries of Sierra Leone and Liberia. On July 2014, it had reached the capital cities, which is the Sierra Leone and the major neighboring countries. August 2014, the World Health Organization declared the outbreak of the public health emergency of international concern. Over the years of the epidemic, the disease spread to 7 additional countries like Italy, Mali, Nigeria, Senegal, Spain, and the United Kingdom. It is also spread on the United States of America. As I have said, there were countries that were infected and secondary infections is also occurred in Italy, Mali, Nigeria, and USA. Uh, it is said on the report that because of the neighboring country and travelers, diseases were spread. In June 2016, the outbreak was declared over. More than 28,600 people had been affected and the death toll reached at 11,325 people. Ebola virus was described in 1976 near the Ebola River, in what is now the Democratic Republic of the Congo. It was emerged periodically and infected people in several African countries. The outbreak occurred in multiple villages in the vicinity of Bon Town, but was limited to the Equator province in the western part of the country. The Ebola virus variant that caused the outbreak was closely related to the one that caused the 1995 outbreak in Kikwit, indicating that the outbreak was not related to the large outbreak happening at the same time in West Africa. The West African epidemic was the largest in the history. It started with cases of Ebola virus in forested rural region in south, southeastern Guinea reported by the World Health Organization, and it is on March 23, 2014. It is from, again, the cases were located at Liberia, Sierra Leone, and in the border of Guinea. The identification of cases was difficult because of the weak surveillance and fragile public health infrastructure. The poor infection control measures and strained healthcare systems also contributed to the devastation of the outbreak. Researchers think individuals are first contaminated with Ebola infections or Ebola virus. The infection spreads from the individual to another, possibly influencing countless individuals. It can be on like bats, organic products, or non-human primate. So let's move on to the signs and symptoms of the Ebola virus. Symptoms may appear anywhere from 2 to 21 days after the contact with the virus. It is also called like the incubation period. It is in an average to 8 to 10 days also. The illness is typically progresses from dry symptoms to wet symptoms. Like initially, dry symptoms initially took over like fever, aches, pains, and fatigue. Like for the wet symptoms, it is like diarrhea, vomiting, and other sickness to a person. So here are the possible signs and symptoms if you are infected with Ebola virus. Fever, aches and pains such as severe headache, muscle pain or muscle joints, weakness and fatigue, sore throat, loss of appetite, and many more. And